A cardiac exercise stress test, also known as a treadmill test or exercise tolerance test, is a valuable tool in assessing how well the heart functions under physical stress. It helps diagnose conditions like coronary artery disease and assess exercise tolerance. However, there are certain conditions where this test might be unsafe or inappropriate. These are called contraindications, and they are crucial to understanding for patient safety. First, let's discuss absolute contraindications. These are situations where performing an exercise stress test could pose significant risks, potentially endangering the patient's life. If any of these conditions are present, the test should not be performed. Examples of absolute contraindications include acute myocardial infarction within 2 days. If a heart attack has occurred within the last 48 hours, the heart muscle is severely compromised and under extreme stress. Performing a stress test in this scenario could be life-threatening. Unstable angina. This is chest pain due to inadequate blood supply to the heart, which occurs at rest or with minimal exertion. The heart is already compromised, and adding exercise stress could trigger a heart attack. Severe aortic stenosis. This condition involves a narrowing of the aortic valve, which limits blood flow from the heart to the rest of the body. Exercise can worsen this condition, leading to critical cardiovascular events. Uncontrolled cardiac arrhythmias. Abnormal heart rhythms that are not well managed can lead to dangerous heart rates or rhythms during the test, potentially causing fainting, stroke, or sudden cardiac arrest. Symptomatic severe heart failure. In patients with advanced heart failure, the heart's ability to pump blood is significantly reduced. Exercise can exacerbate symptoms and lead to severe complications. Active endocarditis. An infection of the heart valves or inner lining can worsen with exercise, potentially leading to systemic embolization or worsening of the infection. Acute pulmonary embolism. A blood clot in the lungs can cause severe respiratory distress. Stressing the heart with exercise in such a scenario could be life-threatening. Next, let's move on to relative contraindications. These are conditions where the test might still be performed, but only if the benefits outweigh the risks, and always under careful medical supervision. Examples of relative contraindications include left main coronary artery stenosis. This condition involves a significant narrowing of the left main coronary artery, which supplies a large portion of the heart muscle. The test might be conducted, but with great caution due to the high risk of a heart attack. Moderate stenotic valvular heart disease. Conditions like aortic stenosis or mitral stenosis limit blood flow, making exercise potentially dangerous, though not absolutely so. A stress test might be warranted in specific cases. Severe arterial hypertension. High blood pressure, particularly when systolic blood pressure is above 200 millimeters of mercury or diastolic is above 110 millimeters of mercury, can be exacerbated by exercise, increasing the risk of stroke or heart attack. Tachyarrhythmias or bradyarrhythmias. These are fast or slow heart rhythms that can make exercise testing risky, as these conditions can worsen with physical exertion. Hypertrophic cardiomyopathy. This condition involves thickening of the heart muscle, which can obstruct blood flow and cause serious complications during exercise. However, it might still be indicated to assess exercise tolerance under controlled conditions. Mental or physical impairment leading to inability to exercise adequately. If a patient cannot follow instructions or perform the exercise adequately, the test results may be unreliable, and the patient might be exposed to unnecessary risks. Recent stroke or transient ischemic attack. TI exercise could potentially exacerbate the condition or lead to further neurological damage. In summary, understanding the contraindications for a cardiac exercise stress test is essential to avoid adverse outcomes. Absolute contraindications are situations where the test is outright dangerous and should be avoided. Relative contraindications require a careful assessment of risks and benefits before proceeding. It's always important that a healthcare professional evaluates the patient's overall condition to determine whether an EST is safe and appropriate. Patient safety should always come first.